the show, everyone. As you all know, I made it possible for everybody to talk on the radio about themselves. Who doesn't like to talk about themselves? So if you want to get heard on the radio, give me a call here at the station at 602-277-5369. We'll get you hooked up with me to get you heard on Networking Arizona. I'm going to go right in with networking right away with my first guest. I'm really excited about having him on. This is going to be really informational. Listen up. I have with me Kent Dix, and he's the owner of Life 365. Welcome to the show. Tell everybody a little bit about yourself and what you do, what we're going to talk about today.
Thanks, Carol, and thanks for having me on the show. I'm a serial entrepreneur for Arizona. I'm one of the rare natives, born and raised here, an Arizona State graduate, and we started our company, Life 365, which is a digital health platform in trying to connect people outside the hospital, at home, to try to monitor themselves, whether it's glucose or blood pressure or weight or even activity that's out there, to try to send the data back to their doctor so they can react to it and prescribe therapy and try to keep them out of the hospital, reduce healthcare costs.
How do they do that?
So, a lot of people have smartphones, right? They're out there. Some people use them, some people don't. We use the technology on the smartphone to talk to a scale or a blood pressure device or a glucose device to send the reading from that, they call it Bluetooth, from that Bluetooth device over to the phone, and it goes to the cloud, the internet, and stores it in the doctor's records. This is not our first company that we started. We started a company before this called MedApps, which we sold to a $3 billion company back in July of 2012, and I became CEO of the division. MedApps is probably one of the first companies to be able to connect people outside the hospital and send the data to their doctor, to be able to monitor them and try to keep them out of the hospital, right, to do. So it's incredibly important that we are using technology to try to work with our seniors and those with chronic conditions. 77% of our senior citizens have one or more chronic conditions. Our seniors also want to live in the home longer, their homes longer, instead of having to move into independent living or assisted living or even with a loved one. And so we make technology that can be able to be used at home. They don't have to use their smartphone on our new company, on Life 365. They use a little tiny hub device that goes in the home that talks to the devices and sends the data to the cloud.
So it's easy to use.
It is.
Because that's important when you're talking about us seniors,
Yeah. Well, I don't consider you a senior, but go ahead.
Well, I am, though.
Yeah, right.
But here's the thing. I want to know what the reasoning, there had to have been a reason behind this in the first place. There was a problem out there, and you're solving it.
Right. The problem, we started this 10 years ago, and the problem, I think at the time, the healthcare we're spending in the U.S. was close to $2.5 trillion. We're way above $3 trillion now. We didn't have Obamacare at the time. A lot of people were getting sicker. It was getting costlier, and we, as a country, were going broke from that perspective. People wanted to live in their homes longer with better quality of care, so we knew that we had to do more. Doctors had to do more with less. And part of trying to give tools to people to monitor themselves outside the hospital was the way to go.
Now, your website is life365inc.com, and this is something that people have to understand. Why is it so important for the doctors to have this information?
First of all, it's important to be able to go. I was going to say a couple different things. Doctors don't necessarily need to have any more data. I mean, doctors have all the data in the world that's out there. But what is important is that doctors have the ability to see data that is occurring real time or near real time. In the old healthcare system, before we started bringing electronic health records out in the last 10 years, a lot of doctors or a lot of hospitals got access to patient data off of insurance claims. So 90 days later, they got a bill that showed that you went into the hospital and you had a diabetic episode, right? And they paid for it. They didn't have any way to be able to go through and try to intervene ahead of time to try to get you compliant or adherent and try to keep you out of the hospital. So what this technology does is allow us to be able to react real time to before you even get to the hospital to try to save healthcare costs. So give you like a real example. We were featured on CNN with this. We were working with the healthcare system in New Jersey with congestive heart failure patients. Congestive heart failure patients, on average, go back into the hospital, 47% go back in 30 days. 60% go back within 60 to 90 days. Sorry, let me do it right. 27% go back in 30 days. 47% go back in 60 days. I want to say it right for you. So, to a healthcare system that's now responsible for the care of the patient under the new legislation that's coming out, the hospital systems are responsible. If you come back within a 30-day period, they're responsible financially for you, right, going forward. So the hospital system, we would give the patient a scale and our device and send them home, and the data would go back to a nurse at the hospital to monitor you. If they started seeing the weight go up, they would call you and basically say you're retaining water, which can exacerbate your disease state and cause you to go back into the emergency room. It may be a situation of just educating you and saying, Sal, lay off the pizza, right? It's causing you to retain water, which makes it bad for your heart. Or you need to take your Lasix or your medication, right, to do. If we can get those early indications, about your health at your point of care, at your home, without you going to the hospital, we're going to save a lot of money.
Now, the website again is Life365 Inc. INC. 365 life365inc.com. You can check out the information there.
Correct.
In terms of it, for the people that are listening to this, it sounds to me like I would want my doctor to have anything about me, especially if I'm dealing with an illness or something like that, which many people are. How fast, obviously, does it get to them when it all happens? How does it occur?
So we're using, in some cases, cellular technology. It's a little tiny cellular chip, not like your phone, but the same technology. And we're talking about within minutes, right, to go to the cloud and be able to connect. That's pretty revolutionary to be able to do that. And we're making it now so the user doesn't even have to use a smartphone. Statistics show that 60% of seniors have a smartphone. 90% don't use it for more than just dialing the phone. That's the current statistics that are out there. Even myself, maybe I'm approaching being a senior, but even myself, I want things to be simple, right? I hear all the time in my mom went from a smartphone back to a flip phone, and she'll just say, I'm stuck in time, right? I don't want to learn anything new. She likes playing with her tablet and everything else out there, but she just doesn't want to learn anything new. So we want to make this technology very simple and very easy. The things that have occurred over the last, I would say, 5 or 6 years is that we now have different ways the doctors are being paid. Doctors, not to be technical about it used to be every time you saw your doctor, they got a fee, right, for seeing you. Now the new payment plans that are coming out, which are called fee for value, means that a doctor has to take responsibility for their patients to make sure they're actually incrementally getting better. So if they're not getting better, they don't get paid, right, going forward. So a lot of people are starting to use technology like this to connect to the patient and to be able to keep them out of the hospital and have a better quality of life.
Well, you mentioned it, perfect timing, because what we want to know is who pays for all of this, right?
Yeah.
And how does that happen? How does it occur?
So, like I said, under the new payment plans that are out there, the people that are financially responsible are typically the hospital systems, the insurance companies, the home health care segments. There's new plans called accountable care organizations. There's over 500 now in the United States. Large self-insured employers. So a lot of people like that are financially responsible for the patient. So give you an example, like a union company like Ford may have current working employees that I call working chronic people that have chronic diseases that they need to maintain. But they also have retirees as well.
You have something that's coming up February 16th. We only have less than a minute, and I want you to get it out. Go ahead and tell them about it.
So I'm proud to be part of a team called Aging 2.0 Phoenix, and we have an event on February 16th at 5:30 at the Granite Reef Center.
Is all the information on the website?
It is.
This is new. This is something that everybody should check out, and you're just talking about it today here on the show. So go up on the website and check it out. It's Life365 life365inc.com. And don't forget, February 16th at Granite Reef Senior Center, they're having Aging 2.0. Check it out at life365inc.com.